Madam Secretary, could you call roll today for the District Board of Health meeting Thursday, April 24th, 2025?
Yes. Chair Reese,
Here.
Vice Chair Andriola,
Present.
Councilman Anderson,
Here.
Michael Brown, Dr. Rika Denko,
Here.
Steve Jusko will be absent, Dr. Eloy E. Duarte.
Present.
Chair, we have a quorum.
Thank you so much, Ms. Valdesman. And for my colleagues' benefit, we're having some technical difficulties with our mics, and at times they're not picking us up, which for us is not a good thing because we've got some issues with making sure we're recorded. So when you are speaking, even if it's just an affirmative vote, make sure that the mic is on, make sure that it's close enough that they can hear you. Okay. Thank you so much. We'll start with the Pledge of Allegiance, and I'd love to have my friend Meredith Tanzer lead us in that. Meredith, would you mind leading us in the Pledge of Allegiance?
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item 3 is public comment. Ms. Valdesman.
Yes, Chair. We do not have any public comment registered, but I will read our message. All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. And we do not have any registered public comment, Chair.
Okay, thank you so much. And I'll just invite anyone in the public at this time who is desiring to speak to just let us know that, and we can get you down and registered. It's a full house today, so thank you all for being here. I'll go now on to item 4, which is the approval of the agenda. And before we seek a motion for the approval, I'll just note for the board and the public, items that are being removed from the agenda for a variety of reasons include item 7.B3, on the consent, which requires us to go back to legal and have some changes. And then also we'll be removing item 8A as an apple, and will be rescheduled to another time. With that in mind, if there are no changes from the board, I'll look for a motion for approval.
Mr. Chair, I'll move to approve with noted changes.
Okay, I have a motion from Ms. Andriola, a second from Mr. Brown. Any other discussion at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye and mark
Aye.
on your pad if you could, please. Any opposed? Nay. Motion carries unanimously. Okay,
Chair, can I
Dr.
get your vote, please?
I don't see it on the pad. It's not coming up, but
I'll vote for you.
thank you so much. Okay, we'll move on to item 5, which are some very special recognitions today. And I'm going to turn it over to you, Dr. Kingsley, for some great opportunities to honor our folks here at the Health District.
Great, thank you. There's the mic problem. I'll be stepping down to the stepping down in front of the board. Check. At this time, would Director Latrice please come down and accompany me?
Lisa, we can't pull the wool over your eyes, can we? They've got work to do. Lisa.
On behalf of the District Board of Health and the entire Northern Nevada Public Health leadership team, we extend our heartfelt congratulations on your retirement and deepest gratitude for your 30 years of dedicated service to our community. Since beginning your career as a community health nurse in 1995, you have steadfastly advocated for health equity, access, and innovation in care delivery. Your leadership as Divisional Director of Community and Clinical Health Services has helped shape a healthier, more resilient Northern Nevada. A 30-year career in public health is more than a personal milestone. It is a legacy. Your work has touched thousands of lives, from immunizations and chronic disease prevention to mental health and outreach in underdeserved neighborhoods. The ripple effect of your commitment will be felt for generations in both the systems you help build and the lives you've helped protect and empower. As you enter this next chapter, please know how deeply respected and appreciated you are. We wish you joy, relaxation, and continued fulfillment in the years ahead. Your wisdom, compassion, and leadership will be greatly missed, but your impact will continue to guide us. With admiration and warmest regards, the District Board of Health. And actually, we're not done yet. If you guys, we'll do this a second time for Lisa. At this time, I would like to invite down Molly Rose Lewis from the U.S. Senator Jackie Rosen.
Hi there, Molly Rose Lewis from Senator Rosen's office, and I am here to present you, Lisa, with this Certificate of Special Congressional Recognition. It is in recognition of your 30 years with Northern Nevada Public Health, retiring as the Director of Community and Clinical Health Services. Thank you for your dedication to community health, and congratulations. From Senator Jackie Rosen. Thank you to you.
Ms. Latres, would you like to say a few words? I know that a couple of our board members would like to say a few words as well, but I'm happy to have you here today. It's been such a privilege to work with you these last many years, and we're excited for your next journey and adventure. Can I invite my colleagues on the board if anyone would like to say a few words? Dr. Danko, you're up first, I think.
I just want to say thank you so much for everything that you do. Working with you has been a joy and an honor through some of the toughest times that we've ever had to experience through COVID and a pandemic. And you did so many things and everything with a smile on your face and to serve the community and to serve people. And my heart goes out to you. I've learned so much from you, and thank you for everything that you've done and for teaching me.
Lisa, I knew you long before I was ever on the board, and you were always the person we went to. You had the answers. If you didn't, you found them. You educated us in a lot of different ways, and I ditto what you said about during COVID and everything you did for our community. Enjoy retirement. You well deserve, that's for sure. Thank you.
So on the opposite side of the end, I've just recently met you, so I appreciate certainly all of, I think that's a testament when you have folks that have known you a long time to your character and dedication to 30 years. I know you were just a child when you came in. But I also want to echo everyone. I think for the short period of time I've gotten to know you, it's certainly clear your leadership is going to guide that path, which was also stated, and I really appreciate getting the opportunity to know you. So enjoy your retirement, right? Smell the flowers. You know, life's too short, so thank you.
Thank you.
Mr. Anderson.
I want to say thank you so very much for your service. We truly appreciate it, and maybe you have a blessed future as you go off into a new territory. Thank you.
Oh, Dr. Duarte.
Lisa, congratulations. It was a pleasure to work with you, albeit somewhat briefly, but you were very helpful and instrumental in helping to protect the health of some of our community members that needed a little more help than others. So thank you very much. Congratulations. Happy retirement.
Ms. Latres, would you like to say a few words?
Thank you guys so much. You got me. I was like, what are all these people doing here? Lisa Lautritz, for the record. I feel so blessed to have had my career in public health. It was never boring, always getting to do something new and different, from home visiting to TB, just always something new and different. And I think I'll carry that with me. And I've met so many amazing people, and I hope you all stay in touch with me. But thank you for, I couldn't have done this without each and every one of my staff and everyone at NMPH. It was just a team, and I was lucky to be a part of a really great team. And thank you.
Ms. Latras, thank you so very much for your service. It's been an absolute joy, and don't be a stranger.
I won't.
Thank you so much.
Thanks.
Okay, Ms. Dixon, I think we have a couple of other recognitions. I know that's a hard one to follow, but we're looking at people who are on the other end of that timeline, but heading towards that timeline.
Absolutely, yes. I do not have the great pleasure of following that, but very well-deserved retirement recognition. Yes, so we have 2 years of service, and for the record, Aaron Dixon. And if you'll notice the start date on both of these and what timing we were in public health exactly 5 years ago, but I'd like to honor Lisa Sheretz, who is currently a health educator too in our CCHS division, primarily working in tobacco and vaping prevention and doing amazing work. And then Liliana Wilbert, an epidemiologist who has been in the thick of things since the first day on the job here in our environmental and public health preparedness. So thank you so much to both of them for their 5 years of service.
Thank you so much, Ms. Dixon. And now I think Frenchie Rubio, are you here? Health Heroes, are we going to do some recognitions for them too?
Thank you. Hi. For the record, I'm Frenchie Rubio, an office specialist from Environmental Health Services. In our Health Hero Employee Recognition Program for the month of March 2025, Brendan Schneider from Air Quality Management was recognized for the value of adaptability, and Taylor Stokes from Environmental Health Services was recognized for collaboration, trustworthiness, adaptability, inclusivity, and compassion. Thank you.
Thank you so much. We always enjoy hearing about all of the special recognitions because that tells us that people are happy working here and with us. So thank you for being here, both of you. Okay, that'll close out item 5, and we'll move on now to a couple of special recognitions and proclamations. Under item 6A, I think Craig Peterson is here to present. Air Quality Awareness Week, right? Exciting.
Yes, it is.
Thank you so much for being here.
Thank you, and I'm Craig Peterson for the record. I'm the Monitoring and Planning Supervisor in the Air Quality Management Division. Appreciate the board's support and the proclamation for Air Quality Awareness Week, and I'll go ahead and read that now. Whereas poor air quality can threaten the health of our citizens and visitors, and whereas the increasing intensity, duration, and scale of wildfires has negatively impacted the air quality in the western United States, and whereas children, older adults, and people with heart or lung disease tend to be more vulnerable to air pollution, and whereas the Northern Nevada Public Health Air Quality Management Division is responsible for managing sources of air pollution and assuring compliance with federal, state, and local laws governing air quality, and whereas the Washoe County Air Quality Trends Report, which contains information such as national ambient air quality standards, local ambient air monitoring network, and current air quality design values and attainment status, is available at ourcleanair.com. And whereas AQMD is dedicated to the protection of air quality and the safeguard of public health for all of Washoe County through the development and implementation of effective programs and regulations while supporting economic growth, community partnerships, and environmental justice. And whereas clean air will require a collaborative effort by all stakeholders in the region. Now, therefore, be it resolved that the District Board of Health does hereby recognize the week of May 5th through 9th, 2025 to be Washoe County Air Quality Awareness Week. in Washoe County, Nevada, and encourages community action to reduce air pollution levels during this week and throughout the year.
Thank you so much, Mr. Peterson. Very important message, and I appreciate your delivery of it.
You're welcome.
You sound like you should be on the radio or maybe reading books on audio.
Yeah, Dr. Kingsley told me that last week, so.
That's funny. Well, thank you so much, and thank you for bringing awareness to this important topic.
Thank you. AQMD is working with the comms team to get some information out on social media every day of that week, and it'll showcase all of our Keep It Clean programs, so keep your eye on social media. And then we're also planning a little collaborative media event with Washoe County School District to kind of showcase that battery-powered lawn and garden equipment that we donated last year. So keep your eyes peeled for that.
Okay, thank you so much.
All right, thank you.
Now we'll move on to item 6B, and this is Jordan Marshy. Am I pronouncing that right? I don't know if I am. But this is Emergency Medical Services Week, right?
Yes.
Thankfully, you're here to tell us about it.
Good afternoon, Chair and members of the board. My name is Jordan Markey. I'm a Public Health Emergency Response Coordinator here at Northern Nevada Public Health. This proclamation reads, whereas emergency medical services personnel are called upon to help others through one of the most frightening times of their lives, and whereas emergency medical services is a vital public service with personnel ready to provide life-saving care to the community 24 hours a day, 7 days a week, and whereas the emergency medical services system consists of men and women in both the public and private sectors, including emergency physicians, emergency nurses, emergency dispatchers, emergency medical technicians, paramedics, firefighters, educators, administrators, volunteers, and others throughout our healthcare system who work together to ensure those in need receive the highest level of emergency service. And whereas Washoe County is proud to have organizations such as Reno Fire Department, Sparks Fire Department, Truckee Meadows Fire Protection District, North Lake Tahoe Fire Protection District, Pyramid Lake Fire Rescue EMS, Remsa Health, Truckee Meadows Community College, and Technical Medical, operating throughout the region to ensure the highest quality of patient care and community support. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and the accomplishments of emergency medical services providers by designating Emergency Medical Services Week. Now, therefore, be it resolved that the Washoe County District Board of Health does hereby recognize the week of May 18th to May 24th, 2025 as Emergency Medical Services Week with the theme, We Care for Everyone.
Thank you so much, and I do think we care for everyone. We've got a lot of great folks over here, I know from Remsa and some other folks from Fire. Truckee Meadows is in the house. So thank you so much for identifying all of our partners. It really does take a lot of folks doing the good work that they do to promote good public health and emergency health.
Absolutely.
Some of the scariest times that people experience.
Yes, they are great partners, and we are honored to work with them.
Thank you so much.
Thank you.
Okay, that'll close out our proclamations, and then we're going to move on now to our consent items. And we'll have one more special group of folks before some of our more business items for today. But as to the consent items, let me ask my colleagues, are there any matters that anyone wishes pulled from the consent agenda? If there aren't any, I'll ask for a motion to approve the consent items as posted.
Move to approve.
I have a motion from Mr. Anderson, a second from Mr. Brown. Any other discussion at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye.
Aye.
All those, any opposed? Motion carries unanimously. Okay. Item 8A, as you know, was pulled from the agenda, so we're now on item 8B as in boy. 8B, so this is a presentation. Who is making that? Zarmish Tariq, you're coming down? Thank you so much. Some of my favorite folks in the house today, Northern Nevada Pride, so this is particularly good for me and happy that they're here.
Good afternoon.
Just pull it right down. It's real wiggly. It's like a Gumby.
I think I'm good. Good afternoon, Chairman Rees and board members. Zarmish Tariq for the record. Northern Nevada Public Health's Chronic Disease and Injury Prevention Program is here to recognize a local organization for providing a smoke-free and vape-free environment for our community. We would like to thank the District Board of Health for joining us in this recognition and invite representatives from Northern Nevada Pride who will be joining us and accepting the award today. Currently, about 91% of Washoe County adults do not smoke. Therefore, it's no surprise that there's a growing demand for smoke-free environments. The Extra Mile Award, also known as EMMA, recognizes businesses and organizations that have exceeded the standards set by the Nevada Clean Indoor Air Act, which prohibits smoking and vaping in various indoor workplaces. EMMA recipients have made the conscious decision to adopt more comprehensive policies, further protecting community members from secondhand tobacco smoke and e-cigarette aerosol. The EMMA Awards have been given to various recipients since 2008, including local restaurants, bars, and sport organizations. Today, I would like to invite Yvonne, Meredith, and Sarah on behalf of Northern Nevada Pride to receive an EMMA for their smoke-free and vape-free policy. They provide a safe environment while having fun, making friends, sporting, and celebrating each other. This event is hosted by and benefits the local nonprofit organization called Our Center. So please, come on in.
Welcome, come on over.
Thank you.
And now I would like to invite Molly Rose Lewis, who is a Community Development Manager for U.S. Senator Jackie Rosen, to present a certificate for Northern Nevada Pride.
Hi again, Molly Rose Lewis for the record. And again, I am here to present one of these special certificates of special congressional recognition to you at Northern Nevada Pride. In recognition of receiving this award, thank you for fostering a cleaner, healthier, and more inclusive environment through your voluntary smoke-free policy at your annual festival and community parade. Signed, Jackie Rosen, United States Senator for Nevada. This is for you as well.
So we would just like to thank Northern Nevada Pride for providing a smoke-free and vape-free environment for event participants. Do you guys want to say a word or two?
Thank you.
For the record, Yvonne Allen. On behalf of Northern Nevada Pride, thank you so much for this recognition. We also want to thank so much for the longtime support from Northern Nevada Public Health. We hope to see you all there on September 6th. It's really important for the LGBT community locally to know that our local entities and our local officials really support us. We're here, we're queer, we are your neighbors, we are your constituents, we are your family, and we're very excited to celebrate you, with you, and celebrate our community. Thank you.
Vonnie, what is going to be the status of the parade this year with the bridges closing and Wingfield? What are we doing differently this year?
The Northern Nevada Community Pride Parade will still continue down Virginia under the arch and over the bridge in downtown Reno. We will be moving our festival, though, probably down to Midtown, since Wingfield Park will be closed. But again, Saturday, September 6th, it'll be a great time for all.
Thank you so much.
Thank you.
Congratulations, all three of you. Thank you so much.
Thank you.
Okay, it looks like we're now on to item 9, and Mr. Duplantis. No, okay, I didn't see Barry, so that makes sense. Shannon, thank you so much.
Good afternoon, Chair Reese, members of the board. For the record, I'm Shannon Popovich, Director of Regional Communications for RIMSA Health. You've all received a copy of the February and March compliance reports for your review, and I'm available to answer any questions if you may have any.
Thank you so much. Thank you for being here and for providing the comprehensive review. I think the numbers speak for themselves, so I don't know that I have any questions about that. But let me ask, too, it has been my desire that each of our board members has the opportunity to visit with REMSA during the course of their term of service. And so I want to make sure that I'm inviting you to inquire of our members. Some of us obviously participate every year. Mr. Brown, I think, probably can run a clinic about the goings in and out of there. But please make sure you're reaching out to the board members to invite them to see the dispatch center, all of the different things that are housed there. I've been privileged to come over a number of times also for special recognition breakfast for your staff. We always love to be invited to that as well, but you're certainly one of our most important partners. We have a lot going on in this community that you are a critical piece of, and so I want to make sure to open it up to my colleagues on the board and make sure that they know that they have the opportunity to meet with you. We could come together if it's easier to schedule it that way. We're not trying to put more on you, and I know that all of my colleagues would avail themselves of that if given the opportunity. But that's all I have for my part for your presentation, and I'll ask my colleagues on the board if they have any questions at this time. None? Okay, thank you so very much, and I'll look for a motion for acceptance for the presentation.
I'll move to approve, Mr. Chair.
Okay, thank you so much. I have a motion by Ms. Andriola, a second by Mr. Anderson. Any other questions at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Thank you so much.
Thank you, and I just want to say thank you for stating that we're welcome to invite everybody. I think we have invited everybody. You know you're all welcome, but we'll make sure to reach out if we have missed anyone.
Thank you so much. It's critically important for us that we get to see what your operations entail. So let us know if we need to schedule anything. Thank you so much. Okay, this one I'll turn over now to you, Dr. Kingsley, for item number 13. And I know that Ms. Gutman-Dodson is on the phone and is working long hours down in Carson, so I'm glad that you're there and not here. But let me turn it over to you, Dr. Kingsley, to kick us off, and then we'll go to Ms. Gutman-Dodson. Oh, let's see, where am I? This is why I don't like staples.
You like to run?
Okay, so I jumped ahead. We'll give Ms. Gutman-Dodson a break and a breather, but we'll move on to item 10. Item 10, Madam Clerk, is for possible action, yes? Okay, this is being presented by Ms. Lord. Thank you so much. Hello. Hi.
Hello. Good afternoon. Latricia Lord, for the record, Senior Environmental Health Specialist from Environmental Health Services. As you can see from your board packet, for the Sewage, Wastewater, and Sanitation Advisory Board, we recently had 3 appointments expire, or they're about to expire at the end of this month. We had one gentleman request to voluntarily resign, and so we solicited new applications, 3 of which were applications for reappointments for current board members, and one was a new appointee, Mr. Robert Sweeney. So Mr. John Adams, Mr. Kenneth Lund, and Mr. Chad Carnes all were due for expiring, and they've all asked to be reappointed. And Mr. Chris Reed was the voluntary resignation. He's a local well driller and just basically said that he doesn't really have the time to commit. So he appreciated the opportunity, but was open for resignation if somebody else was interested. So.
Okay, Ms. Lord, thank you so much for the presentation, and I'll ask my colleagues if they have any questions. I'll be honest with you and tell you that I'm not sure I know what the Sewage, Wastewater, and Sanitation Hearing Board is, so maybe you could give me just a thumbnail sketch of that.
Sure. The Sewage, Wastewater, and Sanitation Hearing and Advisory Board is a voluntary board staffed by or filled by industry personnel. Mr. John Adams, for example, is a local excavator. Mr. Chad Carnes is a local septic design engineer. Mr. Kenneth Lund is a local real estate agent and attorney. So it's staffed by or filled by local industry personnel, and they hear variance requests or appeals for the sewage, wastewater, and sanitation regulations, or our well regulations, which are then presented to your board in the form of a recommendation for your final approval.
Well, thank you so
They
much
meet
for that
maybe about 3 times a year.
Okay, and I understand Mr. Sweeney has joined us. Thank you for being here, sir. I always appreciate that. It's a very thankless job at times, I'm sure, but a very important one, and we appreciate volunteers being here, so thank you for that. Any other questions from my colleagues? If I don't see any, I'll ask for a motion, please.
Make the motion to reappoint John Adams, Kenneth Lund, Chad Carnes as members, and appoint Robert Sweeney as a member for 3-year terms beginning May 1st, 2025, concluding April 30th, 2028, to the Sewage, Wastewater, and Sanitation Hearing Board.
Thank you so much. I have a motion by Mr. Brown, a second by Ms. Andriola. Any other additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? No. Motion carries unanimously. Congratulations, Mr. Sweeney. Ms. Lord, thank you so much. Number 11 is a presentation by Ms. Alexander Leader. Hello, welcome, good afternoon.
Alrighty. Good afternoon, Mr. Chair and members of the board. My name is Olivia Alexander Leader, and I'm a senior registered environmental health specialist with the EHS division. And today I'm really excited to share with you some of the information that we learned during the recent completion of our 2024 risk factor study. So the Food Safety Program completed a risk factor study as the culminating element in meeting Standard 9 of the FDA Retail Food Regulatory Program Standards. And the elements of Standard 9 provide a framework for analyzing the efficacy of enforcement and education actions while emphasizing the continuous and iterative quality improvement that goes on with a regulatory food safety program. And completing the risk factor study specifically provides the opportunity for regulatory food safety programs to demonstrate their public health outcomes. So often, food safety programs are siloed into program analysis through the lens of numerical outputs, like the number of inspections that are completed or the time spent per inspection. And while those metrics are really valuable and provide a lot of benefit, risk factor studies are how food safety regulatory programs across the country can show categorically what they've achieved for public health in their communities. So risk factor studies collect compliance data as it relates to the 5 foodborne illness risk factors and supportive food safety activities, which you can see listed up there on the screen. And while the study gathers data on all 5 risk factors, primary analysis within the report focuses on just the first 4. And risk factor studies were we conducted our first risk factor study in Washoe County in 2017, and then all additional studies are completed on a 5-year cycle. So this was just our second one. The study design adhered to the Standard 9 framework. So data was collected by conducting inspections at a random representative sample of 5 required facility types. And the data collection period occurred between January of 2022 and April of 2024. All data collection inspections were unannounced, voluntary, and non-regulatory, but the corrective actions were required on site for any observed violations while the inspector was out there. The 2024 report compares findings to the 2017 baseline study and identified progress in food safety compliance while elucidating some food safety practices that require a more focused intervention on behalf of our team. So across all facility types combined, the proportion of establishments that were found out of compliance decreased for the poor personal hygiene, improper holding time and temperature, and inadequate cooking risk factors. However, there was an increase in the proportion of establishments found to be out of compliance for the contaminated equipment risk factor. And looking at these statistics, it is still encouraging to see that there was improvement in 3 of the 4 assessed risk factors overall since 2017. So in the interest of our time, I'm not going to go into detail regarding each of the risk factors, but I would really encourage you to review Section 3 of the reports that you've been provided. And instead, I want to just take a moment here to highlight the specific data items that correspond to risk factors that were identified for intervention in our 2024 study. So all of the data items, which you can see listed up here on the screen, were identified for intervention because they were recorded as out of compliance in at least 30% of the establishments at which an observation for this data item was made. And the table can be found on page 25 of your report. And I do want you to note, as you're looking at these data items, that all of those that are marked with an asterisk were also identified for intervention in the 2017 baseline study. And those data items are 1, 5, and 8. And I do also want to note that those are the items that were within risk factors associated with increased compliance between 2017 and 2024. So it's encouraging to see some preliminary indication that our intervention strategies were successful in 2017. I do want to highlight some statistics that I found to be particularly interesting from the report that relate to some of the data items that were highlighted for intervention. First, over half of our full-service restaurants were found to be out of compliance for item number 1, which is practicing proper hand washing. 3 and 4 of our senior independent living facilities were recorded as out of compliance for data item 3, protecting food from cross-contamination. 6 in 10 full-service restaurants and over half of deli departments were found to be out of compliance for item number 5, which is proper refrigeration temperatures. And over half of our full-service restaurants were found to be out of compliance for data item number 8, which is proper date marking of refrigerated and ready-to-eat foods. And I just want to mention that while these statistics can feel a little bit overwhelming, I would be remiss not to mention that the facility is only recorded as out of compliance, not for a single infraction, but our inspectors are trained to identify systemic noncompliance through accurately recording multiple measurements and taking multiple observations while they're out there on site. So furthermore, and aligned with the national trends, results from our study indicate that the median number of recorded violations per facility was greatest across all facility types, with food safety management systems that were underdeveloped, which I've highlighted there in the red box. And with the exception of schools, having an underdeveloped food safety management system is a systemic problem across all facility types, so particularly full-service restaurants and senior independent living facilities. This is a problem that we anticipate seeing decrease over time as more facilities participate in our Active Managerial Control Program course, which is a course that we teach here. It's free to operators to learn how to develop targeted food safety management systems, which we call Active Managerial Control Policies. And that course is offered twice per month here. And then the food safety program here at NPH is a regulatory agency, and we really pride ourselves on providing education as a means to encourage long-term adoption of a food safety culture in our local food establishments. And so to address the data items that were identified in the 2024 risk factor study, we've started implementing several important interventions that I just want to take a moment to highlight. So first, we offer education and outreach programs like the Active Managerial Control Program. That's offered twice a month. We also offer our Food Safety Overview course twice per month, which provides a bird's eye view of food safety practices for our local food establishment operators. And then more recently, starting in February, we started hosting a really well-received food safety inspection boot camp, which provides local food establishment operators with the tools and resources they need to conduct self-inspections at their establishments. And I'm happy to announce that the second offering of that course is on Monday, April 28th, just here on site. And then we also have provided dozens of resources for operators that can be used for food safety training and as visual reminders for food safety practices. In partnership with our Health Equity Committee, we have been able to translate most of these resources into Spanish, Chinese, Vietnamese, Tagalog, Punjabi, and Thai to address and improve equity for access to resources across all of our demographic groups here in Washoe County. And finally, we emphasize a refresher training and information sharing for our own inspection team to ensure consistent application of the regulations. And we recently completed a risk-based inspection refresher training for all of our food safety inspectors this last January. So after completing the 2024 risk factor study report, I am happy to tell you that we successfully met Standard 9, and we were recognized for the success by our FDA retail food specialist in December of 2024. And NPH's participation and success in the retail food program standards has historically supported our receipt of several different grants, including the Retail Food Flexible Funding Model Grant and our Capacity Building Grants. These fund our education, outreach, and program development for our food food safety programs and professional development activities for our inspectors. And it also plays a key role in our accreditation with the Public Health Accreditation Board. And finally, it's a really valuable opportunity to network with other jurisdictions nationwide and share information and resources with those other jurisdictions. So we're happy to have been able to share our success with Standard 9. And then just to conclude, I do want to highlight the incredible daily work of our Food Protection Program field inspectors. With each inspection and community outreach effort, as part of the risk factor study and just part of their everyday duties, our NNPH field inspectors provide education and support to food establishment operators that empowers them to develop long-term food safety practices. And I am really happy to share with you, and it is a privilege to share, that compliance has increased in each of the risk factors identified for intervention in 2017, and due to the diligent and dedicated work of our field inspectors and how they partner with our local area food establishments to improve food safety for our community overall. So thank you so much for the opportunity to share with you today, and I'm here to answer any questions if you have them.
Okay, thank you, Ms. Alexander Leader. Let me see if my colleagues have any questions to start off with. Mr. Anderson.
Thank you. I think I got it now. Thank you for this information. This is great. I was just wondering on a couple things. How well attended in general are the training educational sessions that you guys hold?
Yeah, so for the February Food Safety Inspection Boot Camp, we had 55 establishments attend, and that was multiple people from each of those establishments, so really well attended. And then our active managerial control courses, the one that we held just recently on April 22nd, I believe we had 12 to 15 different establishments there, and that's typical for both of the active managerial control courses that we hold each month.
Fantastic. Sounds like you're getting a good turnout.
Yes.
Just out of curiosity, how do you message the training opportunities to the community?
So we are really happy and proud of our food safety newsletter, which is sent out quarterly to our listserv, the Food Safety Listserv, which is a collection of email addresses for all of our local area food establishments. And then we also provide an email blast when a new training becomes available. So we earlier this week we sent out a reminder email for the upcoming Food Safety Inspection Boot Camp, and then finally we partner with our wonderful communication team, Scott Oxford and Yara de Avila, to publish some social media blasts as well.
It sounds like you're hitting the bases. Thank you very much.
Yeah,
Appreciate it.
thank you.
Ms. Andriola.
I love serving with Councilman Anderson because he asked great questions. I was going to ask that. See my notes. But I just have a couple more questions in that same vein. I was just wondering what times those, both the AMC and the Food Safety Boot Camp are offered. I was just curious.
Yeah, so the Food Safety Inspection Boot Camp is held in the morning. It's 9 to 10:30 a.m. on Mondays. And then the Active Managerial Control is held on the first Monday and the third Tuesday of each month, both from 9:30 to 11:30, with the Food Safety Overview course following the Active Managerial Control course from 11:45 to 12:45. We prioritize mornings and Mondays or Tuesdays because our full-service restaurants often don't open until later in the morning or the afternoon, and usually our full-service restaurants have a closed day on either Monday or Tuesday, so they're not having to pause their operation to attend the course.
Thanks for accommodating that, because obviously some restaurants are even 24 hours a day. So, trying to balance the great information that you're sharing with also the livelihood of a business is important.
Yes.
I want to drill down to the 4 risk factor compliance overall slide, the 3 of the 4, but one in particular, that the 8.8 percentage points in terms of a decrease in terms of improvement from 2017 to 2024 in inadequate cooking is pretty telling. I mean, that's something to celebrate. That's great.
Definitely something to celebrate.
That is the highest percentage, even the one that went up. I mean, that is a huge percentage. And I just think it's interesting. I don't want to get into drill down, but I wonder if there is a correlation. It's interesting that the contamination equipment, that went up just a tad, but the inadequate cooking went down. So it makes one wonder, like, what is that factor? But I'll probably talk to you offline more on that. I am curious. I'll end this by saying, I think one of the things that's so amazing in terms of trying to provide as much information, trying to give everyone an opportunity to be informed so that they can put in practices that, can be then utilized and keeping everyone safe. And I'm wondering if there isn't an opportunity to kind of celebrate those restaurants, if you will, that are doing great. I think sometimes, and you might do that. I'm not sure if you do, so maybe I should be a question before I make a statement.
I do actually, we offer the Excellence in Food Safety Award, and it's a fantastic program for food establishments that receive 3 consecutive passing scores on their routine inspections. And there is a documentation requirement that's if they can show us what type of food safety policies and practices they have on site, and they can utilize their active managerial control policies that they develop in the course as part of that documentation. So we really wanted to make the award go hand in hand, especially for establishments that show improvement over time. And so we can celebrate those successes with our establishments, just exactly like you said.
And I'm bringing that up because I don't want to name, but I went into a restaurant and saw this excellent award, and I thought to myself, how great, right? Because that's just an indication of their commitment to being great purveyors of the business that they're choosing, in this case, the restaurant business. And I'm just hoping that there's an opportunity to also share that on social media and also celebrate that. I don't want to get too much in the weeds, but I do think that sometimes there's a tendency to always see some things that maybe need a lot of improvement, and that gets a lot of attention.
Mm-hmm.
But I think we should be celebrating those that have made a commitment to be the excellent purveyors, right, of what they do. So I'm just throwing that idea out for consideration. Thank you.
Definitely. And thank you for mentioning that. That was one of the reasons that I was so excited to share on this risk factor study report today as well, is that even though it shows we still have some work to do, it shows how successful our work has been so far. And, that success is shared between our field inspectors and how they've partnershiped with our wonderful and hardworking area food establishments. So hopefully we can be handing out that Excellence in Food Safety Award many times over in the near future.
Yeah, thanks for everyone's hard work. Thanks.
Yeah. Thank you.
Mr. Brown. Okay. Dr. Danko, you okay? Okay, thank you so much. I have some thoughts that I'd like to share with you, Ms. Alexander Leader. First of all, the presentation was outstanding.
Mm-hmm.
Thank you so much for your excellent demeanor and your ability to communicate effectively. This is complex stuff, and when I end up getting a 100-page report, it's a daunting task. And you and your team and Mr. Fida obviously work very hard to get through all of this, and then to be able to present it. It takes an additional level of skill, which you obviously possess in spades. So thank you for that.
Thank you.
Second is, so this has been an area of particular interest of mine, I think, as you know.
Yeah.
I had the privilege of being assigned when I first came onto the board and getting to go out and do some inspections with some really great employees, most of which I think are still here. So I didn't drive them off quite yet. But my interest is because what often happens as we sit on this body is that we end up going out in the community, especially those of us who are elected, and we end up hearing the complaints from folks who are in the industry who say, well, why is this happening to me, and why is this in the newspaper? And they feel like some conspiracy of regulation upon them. So what we have been doing the last year is trying to rebuild that trust, and your team has come up with so many different things, and all these trainings have gotten better and more improved, and I think also your staff has gotten more training and different kinds of opportunities. So thank you for leaning in, because I think what I want you to know is that I have no criticism of you or your team, Mr. Fida. The work that you do is important. Preventing foodborne illnesses is something that kind of it doesn't make a lot of news unless we didn't prevent it, right? And so I've learned from Dr. Kingsley that it's about the mosquito bite that didn't happen. It's about the, potato salad that didn't go bad. We don't really hear about those things because we don't hear about them. And so I am trying to lean in, and I just so very much appreciate your staff's hard work in this area because it's hard to go out and do inspections. There's sort of like everybody gets their hackles up and it seems like adversarial. And yet at the same time, you have, through this Food Excellence Award, you've designed a pathway for people to understand that we're not out there to beat anybody up. We want for their success, and that their success really is the success of our community because we all want to have great places to go eat, and we want to have our loved ones be in senior facilities where their food is well prepared and cared for. So I really do thank you for how much work that has been put on this specific issue. Just before the holidays, Mr. Brown and I had opportunity to go work with and have lunch in a restaurant with a restaurateur who had been pretty vocal about his feelings or angst about some of this stuff. And I think what we learned in that process is that your good-naturedness and reaching your hand out in education and training and all these opportunities has really given a great deal of sense of hope for people who are in the industries that you regulate to know that we are here to help them to achieve their best version of their business operations, right? Because I think people want to intuitively make sure their employees are washing their hands and the sink clean out is done right. But it's a lot of work when you're also trying to keep the lights on and make sure the food is good and your advertising is well and your food place is clean. So again, I just think you've gone a long way towards helping to alleviate a lot of the pressure that I have felt on the board. And so for that, you have my absolute sincere thanks and gratitude. What can we do to help your team? That's really where I want this to then head is we can pound the table and say we've got to make changes and we've got to be pro-business, but that gets us only to so far. And now you have something that you probably need from us, which is I don't know what. So I want to make sure I open the space up to you to be able to tell us what your needs are.
Yeah, and thank you so much for that recognition. It is really meaningful to hear. I think the first thing that comes to mind is just when you do hear from an establishment that maybe feels some upset, encouraging them to reach out to the food safety program or to their inspector. What we really hope to see, across all of our programs is that it's a collaborative process of enforcement and regulation, and we want to, if somebody's feeling frustrated by the inspection process, we want to hear from them ourselves so we can provide that as an educational, use that moment as an educational touch point and listen to their concerns and respond and utilize it to improve education around food safety overall. So yeah, if mediating, directing them back to us so we can help to provide that education and utilize that as a moment to connect with them and to collaborate with them moving forward in food safety.
Well, let me ask, the Food Safety Excellence Award or the Excellence in Food Safety Award, what is the reward that they get? Because it sounds like they get a little sticker that goes on the wall. It's not a very good reward. It's a reward, but is it possible that could be expanded to include like, hey, if you've gotten 3 consecutive good, clean bills of health, then maybe you're get a pass on your 4th one? Or how can we make it be that they want to strive for that thing beyond the sticker in the window?
Yeah, so they get the sticker in the window. They get a little gold star on their facility name or next to their facility name on the Washoe Eats app, where everyone, it's a publicly available app for people to look up previous inspection reports. So they get the little gold star. For previous winners, we've also bought some advertising in the Edible Reno Tahoe and been able to display that this was our, Excellence in Food Safety Award winner. We've published an Excellence in Food Safety Award winner acknowledgement on our website, and then in the award package as well is a social media post.
Yeah, that's fantastic. Those are all great things. Let's see if we can't expand it and see what else we can do, but always just be evolving.
Definitely.
Because I do think that when you start to add it up, really is something to be sought after and really people should be looking for. So thank you for
Oh,
that.
yeah. And, kudos where kudos is due and celebrating the wonderful successes and wins that we see across the community as well, that, so often get underrepresented, unfortunately. But, working every day to improve that.
That's awesome. Dr. Kingsley, can you add anything here? Because I know that's something we've been working on for the last year, but you probably have greater experience and knowledge. What would you like to add?
Yeah, just wanted to add in, for the April 22nd, I was able to attend the active managerial control class, and I want to say I commend Olivia and her team. They do a wonderful job. The participants that were there are very engaged. This is a room full of strangers who have to do, activities together, and they get them talking, and they were very participatory for that, and so they did an excellent job. So I want to commend that, and also invite the board members, if you'd like to attend that, they are happy to have you there. They also have staffs positioned at the tables, so they get to interact with the staff members, so it is a wonderful course. And then again, this is, the wonderful point of where we're progressing. I would only say, one thing we looked at, and it's still not a possibility, but we're just looking at with the Excellence Award, if in some way that we can also help reduce their annual fees, a small percentage, to be able to say, you've now accomplished this. We don't ever want to back off and not, give them not show up for that compliance, because that's important, that's essential. But perhaps we can be able to find a way to reward them for their business and their good job by reducing the fees by a certain percentage or something for their next one. So something we're looking into, but we'd like to be able to. We also survive on our fees, but that is something for excellence that we would like to explore, that we are looking into. So thank you.
Okay, any other questions or comments from the board? Okay, I don't see any, but let me leave you with this thought, and that is, I'd like to come to the active managerial class, so if someone can help me get that scheduled, that'd be great. I don't know if I'll be able to do it this next one, but maybe after that. And then the second thing is just please continue to know that it's an open door. If there are things that we can do and know that we need to do better at the board level that can help you, let us know, okay?
Okay, great. Thank you so much. I appreciate the opportunity.
Okay, I think this was a presentation and not identified for action, so I'll close this item now, and we'll move on to item 12. Ms. Dixon, that looks like that's a you kind of a thing.
Good afternoon again.
Hi.
Chair and members of the board. For the record, my name is Erin Dixon. I am the Deputy District Health Officer for Northern Nevada Public Health, and I am here before you to obtain your feedback on a proposed service cut for this summer. As you are aware, NNPH has been having ongoing discussions regarding our fiscal stability. Our teams are taking steps to reduce spending and maximizing revenue. For example, positions have been held vacant, and with final decision on if and when to open a vacant position being made with NNPH leadership. Our grant funding has been maximized through both applying for increased funding and the saving of local funds wherever appropriate and allowed. In addition, we continue to strive to provide the most effective and efficient services to our community, and this includes having outside experts review our services through divisional assessments. Unfortunately, our expenditures continue to increase, with approximately 80% of our costs are personnel, and these experience larger increases primarily due to Korn Ferry and to PERS increases. In addition, some of our divisions had fee adjustments for this fiscal year, and EHS does appear to be coming in under projections. And finally, there is significant uncertainty at the federal level. Approximately 50% of our funding comes through grants, and the future of many of those grants is currently unknown. So what we are proposing is the suspension of large area treatment for the 2025 season. So this means not flying the helicopter or purchasing chemicals in support of mosquito abatement. One of the reasons this was selected is this is one of the largest expenditures that does not impact staffing. For the current fiscal year, this will save approximately $260,000. Our purchase power has been dropping over the past 5 years as the budget for abatement has remained static and costs have continued to increase. And for your knowledge, Northern Nevada Public Health normally treats 4 times between May and September in multiple areas of Washoe County, primarily those with larger water sources. So this is a data-driven decision. This chart shows reported diseases that can be spread through mosquitoes. For the diseases in yellow, the mosquitoes that spread those diseases are not typically identified in Washoe County. We anticipate that we will get those mosquitoes thanks to climate change. We don't know when, but we do anticipate that they will be coming. As you can see, with an effective prevention program, which included our helicopter, we have limited reported cases each year. So, what will remain if we get rid of the large area abatement? Well, surveillance will continue, and our next slide will demonstrate our robust surveillance system. Specific and targeted treatment will continue in small water sources. Prevention and community education will continue and be expanded. Staff will continue to respond to complaints, and there'll be more on that process later. And other vector-borne issues will be investigated and addressed. So we have a relatively robust surveillance system with traps, mosquito identification, and then also testing those mosquitoes for disease. For smaller bodies of water, staff can treat by hand or by other devices. What I want to highlight to you on the right of this slide is the map that was from the 2024 season. Just shows you what our surveillance system looks like. The blue lines are one type of traps, and they have a 2-mile radius on that. The blue dots are another type of trap, and red and green dots are survey and treatments. So this page is updated daily. Actually, it's real time if they plug it in on their phone on what is occurring in their community. And we will continue this for the 2025 season for the community's awareness and education. We'll also be providing information if there is disease identified in any of those mosquitoes. But this is available on our website now. It is blank now, so don't look at it because we haven't done anything in the past 30 days. Respond to complaints. We're going to ask that complaints continue to go through 311 or the EHS front desk. This is our standard complaint process. What we ask for with complaints is a lot of detailed information. We do not take anonymous complaints either, but address, contact information. If people are getting bit, what time of day? Is the land publicly accessible? We can't go on land that we don't have permission to go onto, so those types of questions. So what will staff do? Staff may call the complainant to gather more information. If resources available, they'll do an on-site investigation. Education, a lot of our complaints can be solved with education and outreach, and to determine if treatment is appropriate and feasible. Staff will not be able to respond to every complaint in the manner that the community would like. For example, our team often gets complaints about midges. They don't carry disease. They're really annoying, but we don't treat for midges. There will be increased mosquito activity, and we will not be able to treat for all complaints with active mosquitoes. And that is fully anticipated with this decision. What we will be able to provide is ongoing communication, education, and outreach. The outreach will include planned communication, including social media, collaborations with local news stations, partnering with other jurisdictions to ensure that they have the most up-to-date and accurate information to share. There will also be reactive outreach when appropriate on active disease and areas in our communities that may have increased mosquito activity. Some of the messaging will include as what is on the slide, focusing on what our community members can do to protect themselves and prevent mosquitoes from breeding. If this decision is supported by the board, flyers with this messaging will be available at all of our community events that NNPH is at. They will be provided to the board members, so you will have the information when you get a phone call, and they will be provided to all of our jurisdictional partners. Our team is available to provide information and guidance. If you have not met our Vector team yet, they are one of our incredibly smart and talented individuals. They are also very creative, and they will be able to provide information and guidance. One question that we have received is why it's not partial treatment? Why instead of 4, can't we just do 1? We have provided, how we have provided treatment in previous years is starting early in the season, which allows for intervening earlier in the breeding season, and we're able to use less treatment. Providing just 1 or 2 aerial treatments will require an increased amount of chemicals and would not be as effective. So it would cost more and not quite do as much than if we had a comprehensive treatment. So that is it. I am available to answer questions. We have District Health Officer, Director of Environmental Health Services, and the Program Manager are available as well. And just as a reminder, the decision we are looking for is, does the board support the temporary suspension of large area treatment for the 2025 season, which includes the use of the helicopter and purchasing of chemicals?
Okay, Ms. Dixon, thank you so much for the presentation. Excellent as always. Let me add just a little bit of context too for my colleagues, because as the chair, I spent a bit more time with Dr. Kingsley and yourself. I was aware of this percolating as we began talking about the budget, right? So the starting point was, what are we going to do as a body to make sure that our budgetary issues are handling the things that we must do legally under state law? And then looking at each one of our divisions, each one of our areas in which we work, and saying, are these required by law or are these aspirational? And this happens to be one of the first ones that came up as something that we have done historically. It does have a cost to it. Those costs have escalated without any way to backfill those costs over time. And so that's why now, as the board level, we need to make a policy decision about this particular item. The question, as you've praised it, Ms. Dixon, is actually absolutely correct as to whether or not we would put a pause in this program for this fiscal year in order, it looks like, to be a savings of about $281,000.
It's actually approximately $260. Because of the fiscal year crosses the season, we spent $19,000 for last season. So it would be approximately $260,000.
Makes sense. And so the question is, from the board level now, we need to have this discussion. And I'm going to open it up to the board, but also reveal I absolutely am the worst person for this topic because I hate mosquitoes. They love me. They find me very delicious, and they seem to find me no matter what I do. I could be covered in DEET from head to toe, and they will find me and get me every time. So I'm the worst person to lead the charge, but I am certainly supportive of staff's direction and believe that this is an appropriate response to the economic conditions that we're dealing with. And so that's why I asked for the presentation and that it be brought to the board. So now I'll come to my colleagues who maybe are not as delicious as I am and see what their thoughts are. Ms. Andriola, we'll start with you.
Well, I would like to, maybe nominate the chair to work with the Vector team on those preventative measures that may be appropriate. And you can report back or come in with bites. I don't know.
I would be bitten from head to toe.
I have a question of clarification. Yes. So you spoke about. You addressed, for instance, one of the questions is why can't you do partial? Mm-hmm. So that's where my question is based in that framework. And you mentioned that early on, I don't remember exactly how you put it, but the point is that seems to have get ahead of it essentially in the early season. So that's not going to be done at all either?
No.
Okay.
Nothing with the helicopter would be done.
Would anything be done without the helicopter?
Yeah, so we'll still do small treatments that we can do by hand or by other, we do have a small drone. It can't take the place of the helicopter, but we can do those small isolated spots. We can do those, and we will continue to do those.
And like the chair, I have the pleasure of speaking with Dr. Kinsley as the vice chair and understood that. So I wonder, I'm not sure that I was clear on what those measures that will be non-helicopter. If you could just take a moment briefly just to share what that looks like.
So what you're asking is the treatment that doesn't include the helicopter?
Mm-hmm.
Okay. So normally what it does is the team will look at the traps and they'll identify where there's a large mosquito population. And if there's disease, they will absolutely go out and they will prioritize those. And what it would look like is it's treatment by hand with the same type of chemicals. What? Oh, let me see what I can do, and then I'm definitely going to reach over to Wes for this. We do have a small drone. It is very staff time-consuming, so when we can do that, we will do that as well. Our team does a lot of prevention. And so we will go out, and the team will go out, and if there is standing water or if there is something else of that, they will work with the homeowner to ensure that we'll just get rid of what is breeding the mosquitoes. Let's work with the prevention, and so that we can effectively avoid the treatment and those types of things. Now, I'm going to turn this over to Mr. Wes Rubio, who is the manager, who might be able to answer this more effectively than I.
Mr. Wes Rubio, meet the chair. He was wanting to talk to you right away about it.
I fully understand that. Hello, members of the board. My name is Wes Rubio, for the record. Manage the vector control program here. What Ms. Dixon is referring to is when we say we're not going to be able to use the helicopter, it's cost. And we don't have the manpower to be able to hand treat large areas. It's not feasible, and it's physically not possible with just the way the housing has changed in this community over the last 5 to 10 years. So Ms. Dixon is absolutely correct. We will be working on small sources, but when those small sources are wider than what you can effectively throw with your arm with lightweight product in your hand, that's going to be the limit of what we're going to really be able to treat, unless we're in some areas where we can use our drone. The drone is a very effective tool for certain types of things. It is not a replacement for a helicopter. It cannot carry a person. It has an active flight time of about 11 to 12 minutes. So when we say that, remember that's 6 minutes that way and 6 minutes back to you. It still has to land, it has to do those things. We also have to park, we have to carry chemical. There's a time component to utilizing those tools that is different. So it's just not an effective replacement for the use of a helicopter. And that's really what it is. We're still gonna do that. We're gonna target where we treat. We don't treat where we don't know mosquitoes are at. We don't just randomly throw product out across the county. That's technically not legal. It's also not effective, and it's not good for the environment. We are a public health department, and our focus here is both on the environment, protecting the environment that we live in, and protecting our people here too. And I think those two things are very balanced in Northern Nevada. We have a lot of people here who really enjoy the environment. I hear from them regularly about the death of mosquitoes, and we really do want to honor the fact that we want to take care of both sides to the best of our ability. Hopefully that provides a little bit more clarification for you.
It's great. Thank you, Mr. Chair. I really thought it was important to highlight that the message is not that if the action that's taken with this board moves into a direction of not using the helicopter, that doesn't mean that there isn't still going to be ongoing treatment. And I just wanted to highlight that, and thank you so much. I really appreciate it. I have one more a brief question, Mr. Chair. This is more a question related to, are you aware, I'm guessing, I'm not a mosquito expert, I have experience with mosquitoes, much like the chair, but I'm not as sweet as you, I don't think. The reality is that depending on weather, if it's a lot of rain, that breeds a higher chance of having more mosquitoes. And I'm wondering if there is, I'm just curious, where are we on the weather? Is that a factor that the health department even looks at? I'm not suggesting that that you be, NOAA or anything, but I'm just curious. You can if you want. But I'm just curious, in looking at these difficult decisions that are being made across all jurisdictions in terms of the fiscal impact that we're all facing, I was just curious. Does it look like we're going to have a drier year projections? Have we had more rain? I mean, some of us serve on other boards like TUMWA and WRWC, but it doesn't look like we've had a lot, even though we're doing well on water. Right, Mr. Anderson? I was just curious what that might look like.
So we actually do look at the weather. We record all of those things as we go forward with our program. The senior of the program, Mr. Will Lumpkin, he actually has spreadsheets where we put in the mosquitoes that we capture in certain areas and in regions. We have temperature logs for the temperature zone for when breeding really gets to a risky point for us. It helps us. It knows when we are potentially heading into a riskier zone so that we can try and help mitigate and or manage that to the best of our ability for the community. No, we are not NOAA. We don't have that kind of capabilities. It would be fantastic if we could. That would be a huge bonus for us, but I don't think that's a realistic thing. At this point in time, mosquito breeding right now, so I know it's shocking to most people that we actually have mosquitoes in Washoe County. We do a pretty good job of trying to keep most people away from them. But mosquitoes breed here year-round. We have effective breeding in small sources throughout the entire area, especially because we have some warm hot water springs and things like that in this area that allow them to breed. The breeding has not gotten to a point where it's at a level in which the community is really noticing it at this point in time. So we're just getting started in building up our program, moving resources around to put out traps and look at that. To know whether or not it's really going to be hitting yet is a little too early. It's not warm enough yet that we're seeing a risk. We already know it's going to be cooling off this weekend, so the cool temperatures mean it's really hard for mosquitoes to breed in large populations rapidly. As we get into summer and the water sources start to dwindle and get smaller, it actually helps us a little bit, although the warmer temperatures hurt us, so it's a give and take. At this point in time, it's kind of remaining to be unknown. We'll know more probably by the end of next month as to really what the outlook's going to start to kind of look and feel like. It's the best I could give you as a projection.
I appreciate it. Thank you.
Okay, anybody else have any other questions? Oh, Dr. Duarte.
Question for you. There's more dengue than West Nile virus, according to what I'm seeing. And is there a geographical area of Washoe County that's more at risk for that? Do you screen for the diseases when you capture the mosquitoes? Do you actually look for the different viruses?
I'll answer your last question first.
Okay.
No, we don't. We actually, all that would go to the lab. Typically in Northern Nevada, almost all in Northern Nevada, the lab initially screens for West Nile, Western Equine, St. Louis. And those are the only ones that we typically screen for. If the lab were to see something else, they would do that. We do not do our own screening or our own PCR work at all. So it all goes to the state lab. The state lab handles all of that. We do them in mosquito pools, and so we take a whole bunch of the mosquitoes. They go in a bag, get ground up. Lab does their thing. We don't actually have the mosquitoes that carry dengue in Northern Nevada.
Okay.
Those are outside of the area. At this time, they have not been identified. We cannot find them. Not going to lie. It's possible they're here. We just can't find them.
Okay.
They're small little buggers. So they are difficult to identify, but we don't really have those type of mosquitoes prevalent here. Now, Ms. Dixon did make a very good point, which is very true. Things are changing. At some point, they'll likely be here.
Okay.
We don't know when, but that's also why we do surveillance. And that's why we spend a lot of time capturing mosquitoes, identifying them to figure out what is changing in the community to determine if we have to change our treatment or our methods.
And I have had patients with encephalitis, the West Nile and sometimes the St. Louis. So it isn't a concern. I was a little surprised to see dengue listed because it's not something I think about in my differential diagnosis here in this area. So I'm glad for the clarification. Thank you very much.
Absolutely.
Dr. Kingsley, did you have something to add?
Yeah, thank you. Just a touch point on this. There's a lot of discussion over this point, and we want to make sure that we're being the correct partners for our community. And in many senses, with our community, we have to be partners with them. So we want to develop those relationships so that we work together, that they're well informed, and that we participate together in this. I will say also that, looking at this as inflation plays into this, like it plays into everything in our community. This is also looking at, this is not a mandated service, this is an essential service. And I think all our partners are looking at those services that are in our community that are essential and mandated. And they're a challenge, and this is an essential one that's not tied to staff compared to other, such as suicide intercept model or any of our maternity that are essential and not mandated, but this is one that we can still be able to provide services and education and work with our community. Now, at the same time, we are exploring with the county options that is there other funding options that we can explore? Are there different fines or other ways that we can explore to perhaps better be able to next year be able to have more of an insurance that our budget's not impacted, but if the community wants this service, that we find a way to be able to fund that. So we're working with our county partners on that and on those points. But again, want to thank staff for all their great work and the work that they're going to do. Pool season is also opening up. Everyone's going to want their pools open pretty soon, and we love pools that are chlorinated and healthy for our community. So the team will be also shares those responsibilities, but we will be able to maintain that stability for our community. And overall, just want to say that and if anyone in the community has funding options, more than happy to hear for those. So thank you.
Okay, any other questions from the board? Mr. Anderson.
First, Ms. Dixon, I just want to say thank you for presenting this uncomfortable topic to us. Trust me, none of us that are in local government understand more so than you guys. Right now is a tough time, and we're having to make hard decisions about where we're going to go with our budgets and how we're going to remain solvent. With that being said, I did have a question. So if we approve this and we stop the program for the year, what are we doing to notify the public? I mean, like you talked about in your presentation, some great things that we all need to be doing. And like my counterparts, mosquitoes love me. I think they're more annoying than any other type of insect out there. Not to mention they can transmit disease. So how can we effectively help the community be better prepared and take care of themselves during that time?
Absolutely. And thank you. It is, it's not fun to be up here, but we have to make some tough choices. Well, and you guys have to make some tough choices as well. So our communications plan, if this is approved today, our communications team is ready to go with outreach starting tomorrow so that we can start educating our community, that we have enough time to prepare our community for what we're going to be asking them to do and how we can educate them. We know that not everyone makes behavioral changes the first time they hear something, so the more that we can get that message out before it becomes prime mosquito season, the better off we're going to be. We do have a kind of a full NNPH approach to this. So our teams that go out to community events, they're going to be taking that message out as well. So it's not just going to be those that are listening to social media or those that are getting the news, but we're going to try to do outreach in as many different venues as we possibly can in multiple languages as well. So that is our attempt.
Great. Thank you very much. And I would ask that you also share with us, board members, some of those communication pointers.
Absolutely.
Because I'm thinking of an event that I'm going to be at this weekend.
Okay.
And if you have an audience that you can share this information with, that would be great. So thank you.
100%. And if you would like us to even make copies of everything for you, we can do that for you as well.
Awesome. Thank you very much.
And Mr. Anderson, just because your question sparks a thought for me, I'm not sure how much our public knows about our large area or wide area larvicide program, right? So I'm not sure that the messaging is like it's being eliminated or put on pause. It's just more about the importance of being aware of your health surroundings, that, you know, mosquitoes do exist, they do carry disease. Don't hang out in standing stagnant water, I suppose. I don't know. But again, it's not so much the budgetary issue that I'm saying is the point of emphasis, but the education piece around how to not get bit.
Absolutely, and if I was smart enough to know how to move the slide back, I could go back to the slide that had the education components on it.
No, it's good.
And that's
We
what we're
trust
gonna-
you.
That's what we're going to focus on.
Outstanding. Thank
Yeah.
you so much for that. And let me also say, Ms. Rubio, thank you so much for your expertise in this area. I know that this is an important, and you have a kind of a small and mighty team working with you. So thank you for that. We don't always get to talk about this specific program, maybe once a year as we're trying to think about this. And of course, my hope is that as different opportunities arise, and maybe next year we'll be back on the table. But I do think that it's difficult given the overwhelming cost of the chemicals. I think even as the staff presentation pointed out, the cost for flight time and the helicopters increased greatly. And so I thank you for the presentation, and thank you to your team, Mr. Rubio. Any other questions from our board? Okay, then I'll seek a motion, and just for the ease of making no one have to seek a motion, I'll move to suspend the wide area larvicide services, including helicopter and chemical purchases for the purpose of mosquito control for the 2025 season. And that is my motion. Thank you. I have a second by Ms. Andriola. Any additional questions at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye.
Chair, I'm so sorry. I see that Dr. Ituarte seconded first
perfect.
in the system.
No problem. That's great. Dr. Duarte, I thank you for that second. I'll call for the question. All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Thank you, Ms. Dixon. Mr. Rubio. Okay, now we're on to item 13, which I falsely called 45 minutes ago. But this is an update regarding legislative matters in Carson. And I think Ms. Gutman-Dodson's been patient. And Dr. Kingsley, can you or Ms. Dodson get us into item 13, please?
Yeah, thank you. Just going to go ahead and turn it over to Joelle. Just want to say she's been doing amazing work down there. This has been a very, very busy legislative session, and she has been representing Northern Nevada Public Health in this board with excellence. So thank you. Ms. Dodson.
Thank you. Good afternoon, Chair, or good afternoon, Board and Chair. For the record, my name is Joelle Gutman-Dodson, and I will be presenting the 2025 Legislative Policy Update today. Today is day 81 of 120, so we are getting there. I'm gonna talk about the whole month because we haven't met in a month. But the last couple of weeks have been rather slow because we've had a couple of deadlines that we got through. So the first committee deadline was on April 11th, and that means that all of the bills had to be out of their first committee house by April 11th. So that day on April 11th, 280 bills died. Not nearly enough in my opinion, but 280 bills that were often never heard or never received a work session died that day. And then on Tuesday, April 22nd, our first House deadline happened. So wherever the bill originated from, the House of Origin, it had to get out of that House by Tuesday evening. So only 7 bills died that day, which isn't very many, but and none of them impact the health district, but they are whittling it down. So that was Tuesday. So since April 11th, we really haven't had many committee meetings. Committees started again today, and they're already picking back up because now they need to be heard, by June to get out of the second house and onto the governor's desk to be signed or vetoed. So things have been pretty slow the last couple of weeks. There's a couple of things I wanted to highlight for the DVOH. And the first was April 4th, our budget item, it's budget item 3234, which had the $15 million recommended by the governor's executive budget. That budget was recommended to close as is. So that was a huge hurdle for us, and that money is still there. The reason being for the huge hurdle is because on May 1st, there is an economic forum that will be happening. But yesterday, there's an advisory board that discusses what's going to happen at the Economic Forum. And the projections are pretty bleak right now. We're looking at about a 2 point, what they said today, what they indicated today, let me make sure I'm getting that number right. It's about a 2.3% across the board budget deficit since their projections last November. So that's going to be a couple $100 million we're going to be short in the Nevada state budget. So I say that our budget closed, our $15 million for public health throughout the state is relatively safe, but with a budget deficit that size, we do need to be aware that things could change. It's highly unlikely that a budget is reopened and money's taken out of it, but it doesn't mean that we're totally out of the woods yet. So that was April 4th, our budget closed. And then on Tuesday, April 8th, our public health bill, interim bill, was heard, SB 423. And this bill creates new base funding for public health infrastructure. This is more geared towards our smaller counties that don't have a health district. This creates it's a $4.925 million piece of the insurance premium tax, which means $225,000 would get allocated to each county through a biennium. So that would be basically enough for one FTE with fringe and all of the benefits associated with it. So we support the bill. This is NACO has really driven this bill, the Nevada Association of Counties, because with the SB 118 dollars that we received last session, SNHD, Northern Nevada Public Health, we received a pretty decent amount of that. We received about $2.4 million, and SNHD received over $9 million. And the smaller counties received such a small amount, like Esmeralda County received about $7,000. It's not really enough to do anything. So if we guarantee this base funding formula, then we know that public health infrastructure throughout the state can start building and start kind of creating their own public health infrastructures in the rurals, slowly but surely. So that was April 8th, and we had a wonderful hearing. Amy Hines-Sutherland from NACO presented very well, and then we had Dr. Kingsley present or testify in support, as well as Dr. Lockett from SNHD, as well as a number of other people from Rural Nevada Hospital Association. I'm trying to think who else supported the bill. We had a lot of support and no opposition, so that was a great hearing. And then a couple of other bills I wanted to just make you aware of that we are working on. This bill, we were recently amended into it, so it's new to me and I'm working on it. It's SB 324, and this is a bill that bans the use of single-use water bottles in the Lake Tahoe watershed. But we were amended in it to enforce the ban of the distribution of sales. So we have been speaking to the bill sponsor, as well as some of the advocates for the bill, to explain that while we are neutral on the concept, we are not the right people to be enforcing this bill. However, the county is really not the right people to be enforcing this bill either. Any sort of enforcement like this would create a lot of, essentially an unfunded mandate. So we're looking for a solution for this bill. I'm not sure we're going to get there, but the bill sponsor is aware that we are not the right people to enforce this, nor is a county or a city. This also impacts Douglas County and Carson City, so I'm in good company with our opposition to the bill. Another bill that's been of big concern to health districts or public health is SB 295, and that is Senator Dinyate's kind of extension from last session of his street food vendor bill. So this one has been heavily amended, and it's taken out a lot of things that we did ask for. He wanted an advisory board for street food vendors. He removed that. He wanted us to provide the cost of carts online, and he's removed that. He's been a very good partner with us working towards a solution. However, there's still one main piece that he was trying to make corn, like elote corn and aguas frescas, under a definition of cottage food that wouldn't have to be regulated and permitted through the health district. So we are still in opposition to that because those foods still require preparation in a commissary, and some of these foods require temperature control. So corn needs to be temperature controlled. We also need to know it's been cooked and prepared in a clean kitchen that's commercially equipped. And we also need to make sure in aguas frescas and fruit cups that fruit has been washed properly, stored properly, and is cut and prepared so that it's safe for the public. So we're still working on that. It did make it out of the Senate, and it's headed over to Assembly Health. And I have a meeting with Chair Brown May in about an hour to discuss that. So we will work through that. There's two other bills I wanted to make you aware of that I haven't played any part of, but I thought you might be aware. AB 3, you might like to be aware. AB 326 is a bill that was essentially a gut and replace. It originally was proposed by the Nevada Rural Hospitals, creating a trauma level 4. However, the bill's been now gutted and replaced to just create a study relating to the designation excuse me, let me read that. Revises provisions relating to the designation of hospitals as centers for the treatment of trauma. So it's essentially creating a study housed in DHHS that will study the trauma system throughout the state. So it's going to be a study that reports back on January 2027. So that's just something we'll follow for emergency management. There's a lot going on in designation of trauma, freestanding ERs, things like that, mostly in the South, but we do keep our eyes on those. So that's AB 326. And then there's one more bill that we got amended into that I'm trying to get it to a place where it would not be a burden on Northern Nevada Public Health. So SB 173 is a big bill about plastics, banning microplastics. And we're not really going to weigh in on the intent of the bill, but in the bill there was an amended piece that they're banning all plastic cutting boards. So but the enforcement would fall on us, the enforcement and the fining of restaurants or cafeterias that have plastic cutting boards, that would all fall on us. So I also need to work with that bill sponsor, Senator Dina Neal. I'll be working with her to tell her, hey, I understand the intent, but we are not the enforcement agency for plastic cutting boards. Our job is to keep food safe and educate and advocate for clean kitchens, but our job is not to be looking at kitchens and checking to make sure that they don't have plastic cutting boards. So those are the bills that I've been focused on this week. Still just paying attention right now, trying to pay attention to what we are getting ourselves amended into. I think you've heard me say that a couple of times. There were bills I wasn't even tracking, and now all of a sudden we get amended in. So that's what happens on the second side of the house. And before, everything starts getting chaotic at the end. So that is my update. Trying to think if I have anything else to let you know. But, we have 39 days left. Thursday will be a big day, and I feel like it really could change the whole tone of the session because we're going to see just how short we are money-wise at the state.
Well, thank you, Ms. Gutman-Dotson, for the excellent update. I always know we're in good hands when you're in Carson representing us, and so I'm very grateful for it. Of course, we all have other folks in the building, too, so Mr. Ciccone from the City of Reno has been very complimentary of being able to work with you, to bounce ideas off you, and I know that it's sometimes difficult to be kind of alone down in Carson, but know that you have friends down there, especially Mr. Ciccone, and fans who are working with you. And so I just share that with you so you know that we're sort of keeping tabs on you, even though we're not always keeping tabs on you. So thank you for the
I
update.
appreciate that. And I'd like to shout out Cadence Matitovich from the county as
Yes.
well. Local government, we protect one another. Clark County, City of Henderson, City of Reno. I love the cities. I love the counties. We all work together really well. So
Yes.
it is nice. We are amongst our people down there.
I love that. There's certainly a sort of a sorority, a fraternity of people there that understand the constant pressure that you're under because it is very difficult. And the sort of abbreviated nature of the session and the rapidity at which things change and those deadlines really creates a lot of pressure. And so please let us know if there's anything we can do to help you in that regard. I have a couple of questions, then I'll turn it over to my colleagues. One is, are you tracking from Northern Nevada Public Health's perspective any of the housing bills? Some of the housing bills, you know, of course, housing is a critical element of public health and certainly a determinant of outcomes at times. If you have a house, you're much more likely to be able to keep up with your medications and your, processing of disease issues or that. Is there anything there that we're tracking, anything that we need to know about?
So thank you for that question. And I don't want to sound negligent. There are so many housing bills, and it is such a huge issue that I track them on our tracker. And if I'm in the hearing or I hear about it, I try to pay attention, but they are so big and so significant, and they could honestly take up a large chunk of my time that I'm not as active as I would like to be, just because the nature of session is so fast-paced that I've had to focus on the things that directly are impacting our budget, directly impact our staff. So I'm not as involved as I would like to be. And then there's a lot of political game playing with the housing. It's what the governor's office has proposed versus what a lot of Democrats have proposed. So it'll be very interesting what will unfold at the end of session, because nobody's going to get exactly what they proposed. It's going to be like a combination of it. So in my end of session summaries, I will include those housing bills, but I don't have enough information to provide you something intelligently right now.
Well, I think you've
apologize.
provided something intelligent just in your response. I'm not expecting you to be tracking those bills in the way that someone who's myopically focused on it is. I just was making sure that if there is an opportunity at all and you happen to be in the room, certainly as a health district, we're supportive of any efforts that would be made to dedicate funding to those streams. So, but I think your answer is spot on, and I thank you for being knowledgeable enough to know where the limitations of your ability to cover so many issues is. That's, I think, an important characteristic, too. Sometimes you got to know what not to jump into. Okay, let's turn to my colleagues and see if anyone has any specific questions about the items that you've discussed.
Mr. Chair, I don't have any specific questions. I just want to thank you for all of your hard work and your continued hard work. It is a lot of pressure and balancing everything, and I think you did a great job in terms of speaking about how important it is to have relationships. It's really important to have relationships, and it's clear that you have established those relationships with the respect that you so deserve. So I just wanted to recognize your hard work and appreciation. It is not easy. 120 days of amounts, hours and hours and hours, and changes in a blink of an eye that can happen. So I just wanted to make sure you know you're appreciated.
I appreciate that. Thank you, Commissioner.
Any other comments or questions from the board? Okay, I don't think we have any, and you've got meetings you've got to get to this afternoon, so we won't keep you too much longer. But I'll again echo Ms. Andriola's comments and say thank you. And if ever you need us, we're just a phone call away.
Thank you. Thank you, everybody. And we're doing our best down here. We have a great public health team. I always talk about Amy from NACO, SNHD, Bradley, and Emma are amazing. So we're holding our own down here, and we're going to get through it.
Love that. Thank you so much for the update. Be well.
Thank you.
Okay, I'll close out item 13 and move us on to the next item, which is, looks like Ms. Griffey is here to present on this item. Item 14 is a discussion and possible approval of the District Health Officer's annual performance evaluation.
Good afternoon. This is Lori Griffey. I'm the HR rep for the Northern Nevada Public Health. You've got the District Health Officer's evaluation in your packet. His evaluation this year, the board approved the process, the questions, and the list of participants at their February meeting. We did distribute it out on March 3rd. We sent out a couple reminders trying to seek support to get people to do their evaluation. It did close on March 17th. The evaluations were weighted in 4 different components. We had the strategic planning initiative that was weighted at 50%, the board relations that were weighted at 20%, the internal leadership and direct reports weighted at 20%, and this community stakeholders engagement weighted at 10%. The separate surveys were sent out to each group so that they got to evaluate the health officer on the areas they actually worked with him on. The results of the board are in your board packet. It was changed to a 3-point rating system this year, with the number 1 being initial minimally effective, a 2 rating met the effective rating, and a 3 is highly effective. A 3 is almost impossible to get. That would mean every single person rated them, and it's a 3 all the way through. So in the 2 area is where we were really aiming for. Mr. Kingsley's overall rating was a 2.4, so it fell right in the middle of the effective rating. We did have a decent participation rate this year. It was at 75.68%. Over the last 10 years, we've had it down to 46% participation rate or up to 88%. So we did a really good participation rate this year. Let's see here. In the community, stakeholder engagement rating was 2.62. As you've gone through the evaluation, you'll notice that Mr. Kingsley did rate effective or highly effective in a couple of the different areas, both in the strategic planning initiatives and the board relations. Since Mr. Kingsley has received a satisfactory evaluation, his contract will automatically renew for another year, and he is eligible for a 5% merit, which is standard for all Washoe County employees, as long as they've had a successful evaluation. We recommend that the board accept the evaluation as presented and approve a 5% merit for Mr. Kingsley this year. And at this time, I will turn it over to Chair Reese to evaluate the health officer in open meeting and to discuss things and maybe set some objectives and goals for him.
Thank you so much, Ms. Griffey. And let me start before you leave the dais or the lectern there by saying thank you for your ability to work with me on this process. I know that early on we had to, we did a slight tweak because I had some things that I wanted to see implemented, and you were very kind and helped us to figure out how to do that. Obviously, each of us at times sits in different bodies in different jurisdictions, and we are interacting with different HR persons in each of those areas, and across every entity that we possibly serve on, especially for the electeds, it's a little different in each one, right? And so what I may like at RTC, it may not work at TUMWA, and what might work at TUMWA won't work at the District Board of Health, but you have made this very easy on me, and the process has been excellent, and so I thank you for your work in this area.
Well,
thank you for that. Let me just say to Dr. Kingsley, do you have some things you want to say? Okay, so you're available. And so what I'm going to do is I'm going to first turn to the board and see if there are comments, concerns, questions, and we'll give you all the opportunity to do that, and then I'll come back to myself. Okay. Okay, well, I'm going to take the opportunity. Since I have the opportunity, I've never shied away from the microphone. So first of all, a couple of things, Dr. Kingsley. Number one, it's been a challenging year in a number of different fronts. Part of that is that when you come into an organization, new to the organization, and that organization has had a leader who's been with it for a very long time, it can be very jarring. And certainly I think any time that a person comes into a community and has not been here and established before, there's oftentimes the sort of the impetus is to first sit back and collect some thoughts for a period of time rather than be a bull in a china shop. And I think you've done that very well to take it in. And also it is difficult because you are charged with coming into an organization which already has a lot of silos at times, and not in a bad way. This organization is really effectively run, and there's a lot of cross collaboration. But people can have their ideas of how the organization has been run and believe that that is how the organization should be run into the future. And so when you're the new guy coming into that or the new gal coming into that, sometimes those two things meet and it can cause some friction. So what I will say is that I gave you what I thought was a fair and balanced evaluation. There were parts where I thought you were doing really effective work, and there are other areas where I thought you needed growth. And I think the reason why I want to convey that to you is so you understand I have a high degree of belief in your ability to lead this organization. I have had the privilege of working with you very closely over the last year, and at times you and I are having to figure out one another, right? My style is not for everybody's, and perhaps I rub people the wrong way, but in that you've been very gracious to me and allowed me to help guide the board level policy direction as best as I could, and given me the space to make some mistakes, which I have made plenty, and I have stepped on some toes in a way that was not a good thing, and so I've had to grow myself as a leader. And you too, to your credit, have done that as well, meaning there were times where you and I had some, not heated, because I don't generally tend to get heated, but some directed and pointed conversations, areas of concern which to me were alarming, but perhaps I didn't have all the information. So you've been very good about helping me to go out, figure out what that information is. Oftentimes it's like Paul Harvey said, there's the rest of the story. I've also had the privilege of working with different subgroups within the organization, and sometimes they have a different opinion about how a thing should be done. And for me, I am best able to help the organization and our community if I listen to all of those voices, I process them, and then try to take what I believe is the best approach as a member of this body with one vote, right? Obviously, yes, I am the chair for a brief period of time and therefore have a bit larger platform, but we all have the same vote on the body. And so those are kind of things I wanted to say. The other thing I will say is I happen to have been out of town when the evaluation came out, and because I am, want to do it, I read it at that moment when I received it. I think I was in some foreign country doing something, and I thought, gosh, there's some good here, but there's also some very hard words to read. And so I quickly reached out to you because I wanted to make sure you understood that reading hard words about yourself can be difficult. And what I appreciated is how thoughtful and graceful you were about it. You didn't sulk, you didn't pout, you didn't say, gosh, those people had it out for me, or that person really is not saying the truth. You said, hey, I've got to grow as a person too. And over the course of a professional lifetime, all of us will face that moment. And I think that how we face the moment determines the outcome, right? If you face the moment at which someone has criticism of you by digging your heels in and blaming the world, then I think that that will determine the outcome. If, however, you do what I think you have done, which is reflect upon it, really take time to think about the things that are being said rather than some of the personal things that sometimes come with evaluations, I think that that is the difficult part. And to your credit, sir, you said, hey, Some of those criticisms are valid, and I have work to do. And so you and I talked a lot about in that conversation too about how to grow as a leader, right? Are there things which you can do to grow as leader? Are there programs either through the county or that you could go to other things where you would learn about some of the effective management techniques that are required to lead a organization of this dynamism? And so I think those are part of the comments that are reflected in my analysis of your year that you've had, and also more importantly, the year I want you to have going forward. And so please take to heart both the difficult and sometimes pointed analyses of your work and performance, and understand that everybody is rooting for your success, because your success is the success of this community. And at the same time, it is human nature that when someone says something critical of us, that can hurt, right? But again, I thank you for leaning into it with us. I think that the evaluation, absolutely a very good evaluation overall. And it doesn't mean there isn't room for growth. And so I just take the good with the bad. As we move forward, we're going to kind of do some check-ins over the next year to make sure that you're on track to achieve the goals you have for yourself professionally, and that you could lead this organization effectively. So those are my thoughts, and I know I've spoken for probably more time than I intended, but I am very passionate about this organization. It is important. I chose to be on this body. I chose to stay here and want to be here. And so in that regard, I choose to come alongside and help you to achieve the goals that you have for yourself and for this organization. Okay? Let me see if that sparks any interest or commentary from our colleagues here on the board. And I apologize, I did speak a rather long time, so I mean no disrespect to my colleagues. Okay? Dr. Kingsley, do you have any words that you'd like to share, anything that you'd like us to know about at this time?
No, for this time, no, just previously addressed the board and those comments and email that I've provided following my evaluation. I recognize that leadership is a journey of a continuous improvement. And the feedback you've provided is humbling and helpful, and I look forward to the growth both of Northern Nevada Public Health as well as myself. Thank you.
Well, and Dr. Kingsley, I'll close out this item and we'll come back to the board by saying it is a unique thing in this state where the leader of an organization must annually be evaluated, and we have these requirements about the open meeting law, and when we are under the law saying that we're going to evaluate someone's character, competence, all those things, it's a public forum. It's not like in the private sector where we can have those conversations privately, and that's a good thing. Our citizens come to rely and expect their ability to evaluate you through all of us. And so again, although a challenging system we've created, it is perhaps not perfect. It is the one that we have, and therefore the one that we lean into as well. So thank you for that. I'll bring it back to the board, and I am looking for a motion. The possible motions and recommendations by staff are here. Ms. Andriola, can I turn that over to you?
Thank you. I just want to add that I appreciate the follow-up, especially the time in outlining all of the goals that you've set, and knowing that those are benchmarks to be measured by. And I appreciate the chair's hard work on, looking at the improvement and update and working with HR and trying to align everything to be in the best interest of everyone, right? Because leadership is about really setting the tone for how the organization is going to respond, and the culture of the organization builds from that. And I did appreciate the fact that you recognize that there are some areas that need improvement. I think recognizing we all have areas of improvement, and I think one of the things that's and your choice of wording in terms of your humility and understanding that, I think, should be also publicly shared, because I think most leaders have a characteristic of carrying confidence, and you want that. But I do think that there's a balance of realizing that there is humility and recognizing what those areas are, as hard as it may be to hear, and then taking that and actually using and executing that in a positive way. I think that that creates confidence in the organization. It creates confidence in the leadership that you need to depend on and the collaboration, because you can't do it alone. You know, part of the success of any leader is to make sure they surround themselves with people much smarter than them, much smarter. And I'm not suggesting that you're not smart. I'm just suggesting that there is talent, and not everyone has the ability to be everything to all people, but a leader is expected to depend on that leadership. And again, I just really want to say thank you for recognizing that there is some areas and then outlining that and following that up. I do appreciate that. So I just wanted to add, recognizing the chair and HR and your willingness to look at continuous process improvement and digging into some areas that may be hard. I think you're better for it when you face things, and then you can overcome them. And then the staff sees that. The staff that depends on your leadership sees that and recognizes that and realizes you need to be a team. There's no I in team, right? So I really want to make sure that that is echoed, that it is not an easy job, what you're doing. It's not an easy job. But it's not easy for the people that are working and depend on you as well. So I think that relationship and building and strengthening that can be really a great thing for our community. So thank you, Mr. Chair.
Ms. Andriola, always wise words. Can I get a motion?
That was a motion.
That's a move to approve the
I'll
district
move.
health
That's right.
officer's annual performance evaluation and approval of a 5% annual merit increase?
Yes, that's exactly
Okay.
what I said.
I have Ms. Andriola's motion. Can I get a second?
Second.
And Mr. Anderson's gracious second. Thank you so much. Any other additional questions or comments at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed, no. Motion carries unanimously. Dr. Kingsley, congratulations.
Thank you.
We'll bring it back now to item 15. This is also by Ms. Griffey and sort of a technical and wonky issue. I'll let you explain it, and then we'll see if we can't get to a motion.
Okay. This is just a quick change to the health officer's contract. Human Resources has recently removed the comp time eligibility for all upper management. So we're looking to have that removed from his contract and to replace it with language where he can be paid out for accumulated vacation time. That is an option that most of us employees already have, and it would just include it so he would have that option as well.
Thank you so much for that brief explanation. As I understood it, there have been changes out of the Washoe County HR side of the house. We, of course, try to follow and parrot as much as possible. So it necessitated a change in his contract.
Yes.
And this is the recommendation from HR.
Yes, it is.
Thank you so much. Any additional questions from our board? Can I get a motion, please?
I'll go ahead and recommend to amend the employment agreement between Northern Nevada Public Health and Chad Kinsley, District Health Officer, by deleting Section 5A, subsection B, compensatory time, which has been discontinued by Washoe County HR from top management, and replacing Section 5A, subsection B, with payment of accumulated vacation to allow for the additional option to receive a cash payment during a calendar year for a range of accumulated unused vacation leave hours.
Okay, I have a motion. Can I get a second, please? And I have a second by Mr. Brown. Any additional questions at this time? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries unanimously. Ms. Griffey, thank you so much for your hard work. We'll see you again next year. Okay, we'll move on now to staff reports and program updates. Mr. Vega has been patiently watching the meeting from the back of the room the whole time. So kind of you, and always good to see you. Welcome. Let's hear about air quality management.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I will keep this pretty brief. I'm happy to report that in the month of March, we had no exceedances of the National Ambient Air Quality Standard, so that's always a good thing. The other thing I wanted to mention is that we processed and reviewed 61 plans in the month of March, and we processed 100% of those in a timely manner. So, really proud of the staff and their focus and effort in getting those turned around in a timely manner. that is my update, and happy to answer any questions.
Very impressive, Mr. Vega, as always. Any questions from the board? Mr. Vega, thank you.
Thank you.
Appreciate you. For the last time, I think, Ms. Latres.
She should talk slow.
No, she's going to talk fast as she can because she's ready to be done with all of us. But welcome, as always.
Thank you. Lisa Lautridge, Division Director for Community and Clinical Health Services, for the record. You have my report. I just want to add that our immunization team has been busy in April. We had 5 school-located vaccination clinics, and they were very well attended. We have 3 outreach events coming up in May. One of those is our Family Health Festival, so we're looking forward to that. That's all I have to add. I'm happy to answer any questions.
Trying to think of a witty way to ask you some very complicated questions on the way out, but I won't do that to you. But again, you have our sincere gratitude and appreciation for all the 30 years of service. It's just incredible. I think 30 years, long time. That's great. Is someone coming along behind you?
Yes.
Well, might you share that with the board?
Yes, I would love to.
Thank you so much.
Christina Shepard was a successful candidate for the division director position. She has been our nurse practitioner supervisor in the clinic, and she's our medical director, our lab director, does all of our pharmacy stuff. So she's amazing. And I think she's going to be wonderful in this position. She would be here today, but she's at a grant writing class, so she's
an important
getting
thing
all
for
those,
a person
those
to learn
skills.
about.
But she will be here next month, and I'm sure Erin will probably do an introduction.
And when is your last day, or when does the transition happen?
She started orienting with me. We've been doing it for months, but officially on April 21st, we started orienting.
Exciting.
And so we'll have next week together, and then my last day will be May 2nd.
Exciting. Hopefully you've got big plans.
Big, big plans.
I'll reveal to you, but don't reveal to her. I've known Miss Shepard since before she was Shepard, but DePoli, I think probably maybe 12, 13 years old. So we've known each other a long time, and I'm excited to see her in this new role. She and her husband and their family are just lovely. I had the privilege of being taught by her mother, who was my high school U.S. government teacher and a principal here locally, just a great woman. So just a great human being, great family. I'm sure she'll be a hard shoes to fill, but I know she'll do her absolute best.
Yes, thank you.
Thank you so much.
Thank you, everyone.
Appreciate you.
Thanks.
Okay. We'll close out that item with Ms. Latres as 16B and move on to Mr. Fida, 16C, EHS.
Good afternoon, Board. So you have my report in front of you. I wanted to highlight a few things, but before I highlight those, I kind of wanted to give a shout out to my staff. Essentially, you've seen some of the talent that I have, and they're the ones that I think make NNPH and serve this community great. And some of those highlights that I wanted to highlight are some of the other work that they do that doesn't always make it before the board. So some of our senior REHF staff, they've attended the Conference for Food Protection, and that is a conference that works with government, industry, and academia, and they kind of lead the way in latest food science. So our team is actually on some of the councils over there leading the way in some of this work. Some of the other work that our folks do as well, in our plan review side, they did some work with the CARES campus to make sure that the dining hall and kitchen were designed for a highly susceptible population. So they're applying those food safety practices to kind of the highest level standard of care and to make sure that even our vulnerable populations are able to get safe food. And then lastly, I do have some of our staff also looking at pursuing some grant opportunities. We're currently in talks with the state. We'll see if where it goes. We're currently waiting on some details for proposals. So hopefully that proposal is regarding to PFAS in unregulated wells, so private wells. So it should be an interesting project potentially. So, and that's all I have for my report. So.
Well, thank you as ever, Mr. Fida, and a special shout out to you and your team over the last, I think, probably 45 days. We've had a couple of wonky food, restaurant issues, and always they happen at like 5:02 on a Friday night. And inevitably, I'm calling you at that hour, and you're so kind to jump in and try to navigate and figure out what we can. That's hard to do, though, to be basically always on call. So thank you for answering the call. Thank you to your team for doing the hard work. And it does sound like you've got some exceptional teammates. And one of the presenters today did an exceptional job. So congratulations to you. It starts at the top, right? You've got to have good leaders to grow good people. So thank you. Any questions for Mr. Fida? Okay, thank you so much.
Thank you.
We'll close out item 16C and move to 16D. Dr. Dow.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I don't have anything to change on that, but I would like to just highlight a few things more happening recently in April. So in public health preparedness, on April 16th, our PHP team facilitated an earthquake workshop as a lead up to a full-scale exercise that's going to take place in May. The workshop's primary focus was to provide subject matter expertise from our community partners, explore information sharing, and integrate information to emergency response planning. We had subject matter experts from various organizations that presented, such as Nevada Energy, National Weather Services, Nevada Department of Transportation, Washoe County Emergency Management, just to name a few. And the workshop ended up engaging an audience of 97 individuals, representing a lot of community partners such as healthcare, first responders, CERT, MRC, the state, and our own NMPH staff. So the program did conclude with a hot wash to gather feedback, and overall the feedback has been highly positive and appreciative. And the information gathered from this workshop will be used to enhance full-scale exercises scheduled in May coming up on earthquake. So in epidemiology, in terms of outbreaks, we're continuing to see a decrease in outbreaks numbers so far in April compared to March, a majority of which are in gastrointestinal illnesses. In general respiratory illness surveillance, influenza-like illness activities have dropped below Region 9 baseline since week 12, which corresponds to the late March dates and has remained below baseline so far. Most of our circulating flu virus this season right now remain flu A, H3N2, but flu subtyping has been showing more flu B Victoria strains in recent weeks. Flu hospitalizations have been generally on the decrease, but weekly and cumulative hospitalization rates this season are higher than all seasons since the 2017 to 2018 season. And our respiratory syncytial virus are continuing to decrease, and COVID cases and hospitalizations remain low and stable at this point. In the world of measles, the outbreak nationally continues. As of April 17th, there's been a total of 800 confirmed cases that's reported by 25 states since the start of the year. Age demographic of the majority of those infected have shifted compared to March, when the majority cases have been in children under the age of 5, but now they're distributing among all the age groups. But hospitalizations remain to target the younger population. There are no current confirmed cases in Washoe County right now, but our epidemiology team is vigilant and has been following up on all reported suspect and probable incidences, working with providers and schools and the Nevada State Public Health Lab. Also in April so far, we've published 2 Epi News, one regarding Salmonella safety during Easter and Passover in line with the holiday, and our 2023 to 24 flu hospitalization and mortality report. But also to come is our Q1 2025 chemical disease statistics summary, which will be published later today, so you'll see that on our website. That's all my update. I'm happy to answer any questions.
No, that was fantastic. Thank you for the update. Any questions from the board? Okay, Dr. Dow, thank you so much.
Thank you.
Appreciate you. We'll close out item 16D and move now to 16E. And Dr. Kingsley, that's you.
Thank you. You have my report for you. I would just believe I'll just comment on the federal correlations currently going on, what we're seeing. We know there's a large amount of shift going on within our federal government. What we're discovering on the public health side is that thanks to our organizations and the connections that we have, and I'm a part of NACCHO and ASTO and APHA, these organizations, and anywhere I participate 1 to 2 a week where we get on, and really the information that we share, we have email change. And so there's kind of a grassroots network of local health departments and states cooperating together to understand how do we progress forward as can best while our federal government makes this shift in understanding. So it's a very positive side that nationally many of our local health departments are working together and help manage through this time, and so we can come out better on the other end. And so looking forward for that continued communication and collaboration that we have and for us and information. And the rest of the report I have before you. But thank you.
Any questions for Dr. Kingsley? Okay, we'll close out item 16E and turn it back over to you, Madam Clerk.
Thank you, Chair. I will read our public comment section again. All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. And we do not have any registered public comment.
Thank you so much. We'll close out item 17 and move it to item 18, which are board comments. Does any member of the board have any announcements, reports, or updates? Seeing none, I'll close item 18, and this meeting is adjourned.